everyone. Welcome back to my YouTube channel. It's been again blessing. Thanks for the support. Thanks for the likes. Thanks for subscribing and thanks for sharing with your loved ones. I hope that all the previous episode has been adding value to you. You've been able to get some clue about some of the issues that you need answers to. Don't forget to comment. Don't forget to put questions in the comment sections. You will get answer in due time. Today, I have a friend in the house. We've been friends for more than a decade. She's a good friend, a colleague, and we've practiced together in the same facility while we're in Nigeria. But right now, she's practicing in the United Kingdom. Welcome, Sharon.
Thank you, Blessing. Thank you for having me on your program.
Yeah. Can you give a brief background of your nursing career to the audience, please?
Hello, everyone. My name is Sharon. I'm a nurse, a nurse practitioner in England. I'm dual qualified, and it's not a lot of people that understand that. That means I can practice with my PIN in two aspects of nursing. We say specialty here. I'm both adult nurse and mental health nurse, and I do both concurrently in order to have my revalidation hours. So I started my nursing career from Nigeria, as Blessing has rightly said. I became a nurse around 2010, and I've been a nurse till date. I think I practiced in Nigeria for about 9 years before migrating to England, and I've been a nurse in England for about 6 years now. I've been across different aspects of nursing. I've been to accident and emergency, community mental health, older adults, complex care. I've gone across all specialty of nursing, both home and abroad here now. And I think that's all about my practice, really.
Okay. Yeah, so you're so resourceful. So my first question is, what inspired you to transition from practicing in Nigeria to United Kingdom?
I would say for me, it's more of trying to get new possibilities. After completing my nursing education, at least I practiced in Nigeria before going for my degree, and I always look out for more. I want to be more. I want to learn more. I want to, advance my career beyond the shores of Nigeria. And back then, most of the trainings we had were based on theory from the textbooks from abroad. I still remember I was discussing with a student last week. I was still talking to her about Sudat and Bruna and Sudat, how big that book was. And now I can have the book on my phone, Then I had to go, the book is very, very huge. And you need to read it very well for your nursing council exams. And so most of the things we're being taught were more of abstract and not really, you can't not really hands-on. Talk about tracheostomy. Then maybe now everything has changed. Like I was talking to a group of nursing yesterday. I was talking to them about perinatal nursing. I know we discuss nursing in our general nursing, or even our mental health nursing, but we talk more of like postnatal, like when people have children, they talk about baby blues, postnatal psychosis, and like that. We're not really talking about perinatal. And I was I'm not even sure if Nigeria is really, really having a specialty for perinatal mental health, because here is a big thing. We have perinatal, we have postnatal, and they are not they are on their own. It's a specialty on its own. So I was like, this is one of the reasons why I traveled. If I go back home now, I can ask questions about, do you have a section for perinatal, like people who are just first-time mom? Do you have first-time pregnancy? It's strange to them, apart from what the cultures will teach them. The mental health aspect of it, in Africa, we don't really go deeper. So I wanted more knowledge. I wanted to advance my knowledge, personal development, career development, and again, something better for my kids. Like when I came to this country, most of the people that met me asked me, why did you leave your country to come here? It wasn't just about my career. It was also about my family. I wanted more for my kids. I wanted where they could be able to reach their highest potentials. And that's the really major reason why I came, really.
So how do you see the way nursing is being practiced in Nigeria compared to how it's being practiced in the United Kingdom? Is there any
Um,
difference? Which one do you think is better? Like,
so for me, I would say the only for me coming here, the only downside would be um, experiencing patients who don't understand my cultural background, my like when I came newly, I've all the most people that I've nursed were all white. I at least nursed like a black patient of till of late that I started seeing black patients in A&E, not even in mental health wards, in A&E. So when I came newly, the cultural shock was most of the people I was engaging with were all people from we're all British background. We're not black. Back home, I only nurse black patients. Here, I started nursing people from another cultural backgrounds, and so sometimes we have friction of beliefs, cultural backgrounds, because we know nursing cannot stand on its own. You nurse people holistically, like where they are coming from. You know, you ask about their social background, their past medical history, family background, family dynamics, cultural dynamics also interwoven into nursing. And so beyond treating patient as a nurse was a challenge of learning the culture, of a challenge of understanding the British jokes, understanding voice tone, not you just speaking English half tone. Um, because I remember they asked, oh, what you've said is not bad, but the tone behind it. So we understand the
so
tone, then
communication skills, you have
skills,
to.
yeah. Yes, we also talk about at some point. I always say, how come you speak good English? Were you born here? I say, no. For me, then, we never, like most of us didn't take that to be a form of aggression. But recently, we started seeing it as a microaggression. I can't tell you as a British person you speak good English. No, English is universal. It's a universal language. If I'm able to speak it, it's because I've learned it. And you saying I speak good English means I'm not somebody like me shouldn't be speaking good English. So when I came, we couldn't differentiate between those
Whether it's
microaggressions
compliments or
or it's an abuse. Yeah. So there were subtle abuse. There are subtle racisms, and they were recently they were classified as microaggressions. So those were the challenges I faced at the beginning of my career here. And but I find myself now I'm British now, and so I find myself doing the same
has
and
been part of them.
understanding it, because I also have children in the house who have gone through this system. Like my daughter she doesn't know another life. She came when she was 5, so the life she has known is here, and she acts here. She acts British. She do everything like British, and so us just not outside my home, even within my home, I have British. I have some microaggressions in my home. My kids can say, "Oh, mom, that's not how to say this. That's how this is how to say it. This is how to pronounce this." They speak Scouse sometimes. They speak correct Queen's English sometimes, and so even within the home, I have learned to integrate and understand the culture. So, like I said, nothing goes beyond you just nursing a patient.
And be emotionally intelligent. You don't take
Yeah.
it personal.
So yes. So one of the most rewarding experience is that I've had as an immigrant nurse was working with patients who spoke the same native language as me back home. But here, I have to now learn the cultural aspect of British and be able to give a holistic and robust care to my patients. Because when you are developing a care plan for someone, I won't be developing a care plan I will develop for a patient in Nigeria. It's a different care plan. Even though
So the cultural
nothing is
competency
universal,
must be there.
must be there. So I was able, like, you'll be able to be cultural sensitive, and be able to nurse them to, like, we see them as partners. It's a partnership, and not you just being the one dishing out orders in your care plan. So I think that's just it. We've been able to integrate into the system, understand how things are done, and then you see those things you've read in textbooks come alive.
Mm.
Nothing come alive. You see those instruments, you see those procedures. It's hands-on. It's not just theoretical. It's not somebody telling you. It's something you've read before.
And it's something you've seen.
Yes, you've nursed in your dreams that, oh, I know these things, but now you are, it's hands-on. You are seeing it. You're able to touch
Handle
them,
it.
and so that improves your competences
Mm.
as a nurse.
Yeah. So that will take me to the next question. Like going through your challenges, was there a time that you now think, oh, why did I take this move? I would have just been in Nigeria.
There's no place like home. No matter how nice, no matter how organized and or how better abroad might seems, you are still a second-class citizen. Like I say, in my country, nobody will tell me I'm black. In my country, nobody will tell me go back to where you come from. In my country, nobody will see me as a migrant nurse. That's my home. That's where I come from. No matter how poor, no matter how disorganized, no matter how bad it is, it's home. And I hope one day I'll go back home. Because
Yeah.
every time you nurse the patient, every time you walk through the streets, every time you go to a gathering, you are seen like an alien. No matter how British I am now, I said I'm British or I have passport now, they will still ask me where, when they come to you to talk to you, they still ask you, where are you originally from? And each time that question comes out, is to remind you that, yes, you're here.
You don't
You
belong
might
here.
be a black British, but this is not your home. Like I've said, every living things, one of the characteristics of living things is movement. There can be movement upward and there can be movement downwards. No matter how we see it, I'm from Nigeria. I'm a black nurse. Was born in Nigeria, trained in Nigeria. Well, they will even put it, you're an overseas trained nurse. So every time that comes up, yes, I feel I'm not really part of them. I feel a sense of discrimination. Every time I have an opportunity to talk, I say to them, yes, I identify and I pass as black. But my background, my cultural background, my training background should not determine my competence. When I work with you, judge me based on my competence, on my interaction with you, on my nursing practice, and not just by my color or where I was trained. I know the stigma will always be there that I'm an overseas trained nurse, even though I've taken some courses here and I have performed excellently well. But when they are still telling you to do your demographic, they will still put it, your background. You will still see a BAME, Asian, African, Caribbean. They are separated. You're not asked. They will ask you, even if you say you are British, they will ask you British by birth or British by naturalization. So that makes me feel not really welcome sometimes, or this is not really my home. No matter how I try to integrate or how best I give myself service of myself to them, I still feel that this is not home.
Yeah.
And sometimes you can go to work and you can see that the discrimination is really glaring at, they are not really hiding it. And then those days are down days. So some days we have up days, some days we have down days. And like I say, as human, we leak. Home can leak to work and work can leak to home. So when people come out and they are a bit racist, I see beyond the words they speak to me. It might be that I'm trying to nationalize it or justify their actions. No, we are human and we can leak. And I see that beyond what they are saying, I see that they are human and they're just trying to express themselves. And that makes me not to take whatever they are saying to me
To heart.
Ashley or to heart. I try to work around it. For now, this
That's
is my
where
reality.
emotional intelligence comes in.
Yeah, this is
Yeah.
my reality for now. Yeah.
Okay. So that will take me to the next question. I like the dimension in which this discussion is going because most people will always talk about the good parts. So I like your sincerity about asking this question. But the next question would be the original purpose for you migrating, was it achieved?
People can thrive. You can, if you choose that I will thrive, you will thrive. Irrespective of the challenges, if you want to thrive, you will thrive. It depends on who you are, how resilient you are, what make you, why did you move? At every point of your challenges, your why will be your
The
driving
driving
force.
force.
And your why is dynamic in nature. My why 2019, when I moved, is not the same as my why now. My circles of friends when I moved are not the same now. My support system when I moved 6 years ago has changed because as human, change is
It's
constant.
constant.
If you choose to stay in a place, if you choose to come to a place and you refuse to change or integrate, you will always sing the song of woes. It's not good, it's not right, I'm not doing well. Yes. And again, as Africans, we are known for competition. And sometimes competition can be unhealthy.
Yeah.
And it can also be healthy. And if you come to abroad, you're not just seeing your fellow Africans, you're seeing Asians, you are seeing other ethnic groups and cultural backgrounds beyond the country where you live. And I think as you interact with those people, you should be able to borrow a leaf from their way of life. I've interacted with Indians, Asians, Pakistanis, Japanese. Last night, I was just with Japanese doctors. And the same thing I would do as an AMP, the way we do things, even as a Nigerian, the same thing the Japanese doctor did. The Nigerian doctor came to do the same thing. And even though it's the same procedure, there's a little bit of cultural influence on the way they attend to the same patients. And like I say, we are human, we are complex, and these things make us who we are, make us unique. If people see a Nigerian doctor, they know Nigerian doctors are very brilliant, but sometimes there's a way of doing things that we might need to tweak a bit to suit the environment that we have. We're doing the same procedure, and the same way the Japanese doctor tapped this patient, and it's not the same way a Nigerian doctor tapped. And I see, while I was there observing, I see the difference. And in my mind, I say, this is it. Two people doing the same procedure. This is a universal procedure, but their personality shine through. And so when you say, oh, if you don't like the place, move, how long will you continue to run? What is pursuing you? Sometimes
What
I don't know.
assurance do you
I'm not
have?
sure I don't know if this discussion is going the right way. I'm not sure if it's going the right way or I'm deviating, but I don't want to deviate and take your time. So the nutshell is that the conclusion is that we are human. If you think where you are is not good for you, have you looked inward? Is it the environment that is not good for you, or is it you that is not opening up for opportunities in that environment?
So, what advice do you have for people back home that are still contemplating? They have the dream, but because of the information they are hearing up and down, they were thinking, does it really worth it? What advice do you have for them?
It's worth it. It's what it is what the dream is worth it. And I'm saying that from my own personal point of view, and from other stories from other people I've supported to come to England and how they thrive. I'll tell you, is worth it.
If you have the dream.
If that's your dream, go for it. Dream will always come true if we work at it. And if you don't have the dream or you're tired of it, you choose what works for you. Like I'll just tell you, if that's your dream, go for it. There will be days you will regret it. There will be days you want to pack your bag and run away. You will be alone. You will be abandoned by those who love you at some point. Because they might not understand your dream. They might not understand your drive. If you will not rely on one source of support, because that support might disappoint you. The word abandonment, I know it's very well in this journey. You will be abandoned. You will meet challenges. You will be betrayed. You will face daunting and darkest nights. Some nights will be longer and some days will be shorter. But if this is what you want, there's always light at the end of the tunnel. All I can say is if that's what you want, irrespective of whatever anybody is saying to you, have they come back home? Those who are saying those things to you, have they come back home? That's when you will know that it's not everything people say to you that is 100% true. If you want to come to England, come to England. You will not regret your coming. Just know that it's not going to be easy ride.
Oh, true.
Not your country. You were not born here. For me, I don't have support system. My support system, like my boss, each time I leave work. Last night, I went for a supervisory role, and they already know, but they ask every time, Sharon, what will we be doing for the rest of the evening? They already know. I have no social life. I don't go out. It's my work, my family, and my bed. Doesn't mean I'm antisocial. It's just that for now, that is a sacrifice I have to make. As time goes on, it
Things
will
will
get
change.
better. It's getting better. I'll be open. I have about 16 trips booked this year. That wasn't the same last year. I was stuck in my house. But now this year, I have 16 trips booked this year. My son have about 4 trips booked. My daughter trips is also there. So it wasn't like this 6 years ago. It wasn't like this last year. As the time goes on, as the years roll by, your dreams will become clearer. Those naysayers will see it clearer. They will come and acknowledge your hard work. They will see, but even as Christians, Bible says, he will endure to the end. Sorry, I'm a Christian. And so in my interaction or whatever I do, if my beliefs,
Reflect.
my faith comes true. So my Bible says to me, he who endures to the end will be safe. He who endures to the end will enjoy the reward of their hard labor. I work now. If I want to work, I work when I don't want to work. It wasn't like this 5 years ago. It wasn't like this 2 months ago. There's always a time of rest. And so the problem is people want to rest before work. I think work comes first before rest. And you know that when you come to a new country, you have no families here, you have no support system here, you are starting from ground zero. Sometimes you have no ground to start from. If you're in the UK, it takes you the first 24 months to stabilize. And when I mean stabilizing, it means you have credit ratings, you have credit record, you have savings, you have bank accounts, you have an address, somebody can know you. You can't just come from Africa and you say you want to collect loan, or you want to come from Africa, you want people to trust you. No, you need to work. They need to see your work. They need to see your character. They need to see who you are. They need to see your expertise. You need to earn it. Even back home, you can't just finish as a nursing RN, NO2, and you want to be SNO tomorrow. No, we work through the cadre. We work through the banding system. And so if you think this is what you want, I will encourage you, from someone who has gone through it single-handedly, initially with little support, but later with no support. And I have thrived. I have grown. My kids came to this country at age 5 and age 8. My 8 will be 14 tomorrow, and my 5 is already 11. And so I can tell you, if you endure, if you persevere, there's always light. There's always reward. And so if that's what you want, if that's your dream, apart from your family, because I think I've talked more about family, and that's who you are. I am. I'm family oriented. Your career will advance. You will play on world-class stage. You will play with other professionals from other walks of life, from other ethnic background, from other cultural, from other nationalities. You're not just a local champion now. You are playing, even though if you're a band 5, even though if you're a band 2, you are playing on the world stage. You become a global nurse. You become an international nurse, a multicultural nurse. Because if I can nurse people from different cultural background and I can communicate effectively, I can, make a care plan for them, and people can interpret, can see my care plan, can see my reports. I do biopsychosocial assessment, and people can see it even in Canada, and they can interpret it, they can see it. My nursing has cut across beyond British nursing. I'm a registered nurse in Canada. I'm a registered nurse in Australia. I'm a registered nurse in New Zealand. If I'm in Nigeria, these things I don't think are really possible. All these things I've achieved are just because I'm a British nurse. So if that's what you want, please go for it.
Thank you. Thank you. I love that word. If that's what you want, please go for it. Thank you, Sharon. Thank
You're
you.
welcome.
You really, really, as in dig deep. And I hope it's going to inspire someone. And that's the reality. No sugarcoating or whatever. That's how it is. It's not going to be a easy ride all through. There will be some ups and downs, just like you said. But if we persevere, then we'll get there. Thank you. We are going to
You're
stop
welcome.
here, and I appreciate you for honoring my invitation all the way from England. And I thank God for how far we've all grown. Yeah, those notes then. I appreciate God for all your achievements. Thank you. Thank you so much. We are going to stop here. Thank you. See
Thank you for
you.
the privilege. Thank you for the opportunity to feature on your program.
Thank you.
Yeah.
Thank you. Okay,
Yeah.
bye.
Bye.